Welcome back. My name is Dr. JP. I am a doctor of psychology, and today I will be talking about autism spectrum disorder. The essential features of autism spectrum disorder include A. Persistent deficits in social communication and social interaction across multiple contexts. For example, deficits in social-emotional reciprocity, deficits in nonverbal behaviors in social interaction, deficits in developing and understanding relationships. And B, restricted repetitive patterns of behavior, interests, or activities as manifest by at least two of the following: stereotyped or repetitive motor movements, use of objects or speech, inflexible adherence to routine, restricted fixated interests, or hyper or hypo-reactivity to sensory input. Symptoms must be present in the early developmental period and must cause clinically significant impairment in social, occupational, or other important areas of functioning. Severity level is coded in terms of level of support needed for deficits in both social communication as well as restricted repetitive behavior. Level 1, requiring support. Level 2, requiring substantial support. And Level 3, requiring very substantial support. Specification of with or without accompanying intellectual impairment and with or without accompanying language impairment is also recorded. Many persons with autism spectrum disorder also have intellectual impairment and/or language impairment. The prognosis is best with an absence of intellectual impairment and functional language by age 5. Male to female ratio is 4:1. Heritability estimates for autism spectrum disorder are quite high, ranging from 35% to 90% in twin studies, with as many as 15% of all cases associated with a known genetic mutation. Symptoms of autism spectrum disorder are typically evident in the second year of life, between 12 and 24 months, but may be seen earlier if the delays are more severe, or later if the symptoms are more subtle. If you have questions about autism, please leave a comment below. Please like, share, and subscribe for future videos. Thanks for watching.